Good evening and welcome to IHW Council's special web series on women's health, START, Supporting Treatment in Assisted Reproductive Therapy. I'm Anisha Nair-Thapan, your host for the evening, and you're watching our exclusive show on women's health supported by Bharat Serums and Vaccines under its public awareness initiative. Now, we're currently seeing the COVID-19 second wave in India a year after its outbreak. Now, this is just a reminder that we cannot take our health for granted. We cannot put our guards down. We have to ensure masking, washing our hands, and ensuring social distance. This is also a reminder to put our health before anything else. The arrival of the vaccine and the start of the inoculation process and the lessons from last year have brought hope to millions who want to stay at home, stay safe, and bring about a semblance of their pre-corona days. But there are many others who find themselves in despair as some of their dreams have suffered a setback because of the many restrictions of the lockdown and the fear of COVID-19. I'm talking about couples who dream about starting a family but are unable to do so because of infertility. Infertility over the years has emerged as one of the most common health issues that many young couples have been facing. According to the Indian Society of Assisted Reproduction, infertility currently affects about 10 to 14% of the Indian population, and the scenario is even worse in cities where one in every six couples is impacted. Now, our show is special as we are going to discuss all aspects related to fertility and IVF treatment. Bharat Serum and Vaccines Project START is an initiative that aims at providing support to couples beyond medicines with initiatives like microfinancing and counseling. Now, Project START encourages couples to stay on course for the IVF treatment to achieve their goal of parenthood. Today, we'll be talking about tips for successful outcome of IVF. Now, there may be questions in your mind on what you should do to succeed in starting a family. On our show today, we have an expert joining us to help answer all your queries. Please welcome Dr. Mamta Dighe, founder and medical director, Xennith Advanced Fertility Centre, who's joining us all the way from Pune. Thank you so much, Dr. Mamta, for joining us. Welcome to the show.
Thank you for having me, Anisha. Lovely being here.
Now, before I begin this conversation, I want to just remind all our viewers that this is your golden opportunity to ask your questions from the expert that we have on the show, Dr. Mamta. She has been in the fertility treatment industry for a long time and is best placed to answer all your questions. So you just have to type in your question in the comment box of this post, and we will try to take up as many as we can over the next 30 minutes. Do like and comment with your feedback, and also share this special show on the walls of your friends if you think that they may be benefited from the information that we share today. So let's begin, Dr. Mamta. Now, why is there so much anxiety about how to improve our chances of IVF? Now, most people see IVF as a God-given gift of science that, yes, my prayers are going to be answered now. I'm going to go back with the child. So why is this anxiety that what can I do to make sure that I'm successful?
I think, Anisha, it is because even as of today, despite the strides made by technology, IVF does not assure a 100% guaranteed result. Most couples look at IVF as, the last option. So they are already, towards the end of hope that they've gone through multiple cycles, and they feel that now that I do IVF, a baby is guaranteed. And then when you get a negative result, the pain of kind of getting and letting it sink in is difficult. And that is why understanding what it takes to improve your success of IVF becomes important.
But why does this happen? Why is there a negative? It sounds right to making a baby in a petri dish. So once you put it back, why wouldn't it be successful?
Yeah, I guess it's science, but the miracle, of having another life in your womb and your life, I think that's completely still controlled by nature to a certain extent. What we can do at our end is ensure that we have good quality and quantity of gametes. Gametes are the eggs from the woman, the sperms from the man, and therefore we try and make good quality embryos, and we have a good quality uterus where this embryo can implant. So that is what, as IVF specialists, we try to do. But once we put the embryos inside, there is a dialogue between the embryo and the uterus, the lining of the uterus, which then helps this embryo to stick to the lining and burrow into it, leading to a pregnancy. Now, this is something nobody can control. Neither we as doctors nor the patients can control what will happen once the embryo goes inside. So that is where, the problem is the implantation. We haven't yet been able to decode the science or the enigma of implantation.
All right. So you said there are a few things that you can do. You can ensure you have good quality embryos and the uterus is also well prepared. So can you break it down for us? How do you do this? Because if a young person comes to you, if the female is young, the likelihood of you getting good quality eggs is high. What happens when you have an older female who wants to, get an IVF done? And how do you ensure good quality of embryos, and how do you make it supportive for the embryo in the uterus? Do you think that a little baby would like a warm fuzzy place where it feels safe to implant? So how do you ensure that?
Yes, I think you framed the question beautifully, Anisha, because there are different aspects to a successful IVF, and people only pay attention to the physical aspect of it, which is not always just enough. I would say it's not. It's not that it's not true, but it's not just enough. So the most important factor is age, because we know that as the age of the woman increases, we are going to get poorer quality of eggs. And that is something that we can't really change. But what can we do, whether it is at a younger age or at an older age? So I would like to look at, how we can increase our success of IVF. I would probably like to divide it into three. One is the physical aspects. Second is the mental aspects. Third is the laboratory and your doctor and your IVF aspects. And in fact, I think there is a fourth one, and that I would say is the financial aspects. So you need to look at everything, the physical, mental, the doctor that you're seeking, and your financials. Once you prepare yourself on all these fronts, a successful outcome is going to be more assured for you. So just to elaborate in terms of physical, I would say take care of your nutrition, make sure that your body mass index is in the right frame, quit anything like high caffeine intake, smoking, right? Make sure that you're eating the right stuff. It's not just eating less calories, but taking the foods which have a good nutritional value, especially for your eggs, sperms, etc. Having a good amount of water intake. So having moderate exercise and also doing something for mindfulness. So I would say this comes into the physical aspect of taking care of things. The mental, I would say that a lot of women especially get bogged down and tied out with feelings of shame, guilt. They withdraw from social contact because they feel left out. Sometimes they even feel envy when they see little children and start asking why me when everybody else is having children. You need to also take care of your thoughts, your micro and macro environment, because fertility is not just about having a baby. It's about everything fertile in your life: fertile thoughts, fertile environment, everything. So what do we do to have all these fertile thoughts in our mind? Taking care of unabated stress in your mind, that is such an important factor which people just do not pay attention to. That would be the second factor. The third would be choosing the right doctor and the IVF center. Extremely important. And I think one needs to do their due diligence on that. And the last I would say is the financial aspect, because most of the times IVF fails because people drop out of the IVF cycles. They're not prepared. They think one cycle will give a success. And if it doesn't, they drop out of IVF cycles when maybe a next cycle would give them a result. So if you kind of encompass all these things, the chances of success would definitely increase quite a bit.
So for somebody who's coming in for treatment, what role does counseling play? Because most of the time your expectation is just to meet the doctor, for the doctor to see your history and then wave a magic wand and just give you a baby. So how do you counsel your patients, tell them what's involved, how they should be prepared for this?
So I think that it is very important to have good time kept aside to talk to the patient, because they are coming to you not only with their physical problems, but they're coming to you with their dreams and aspirations, and trying to understand, make them feel at home, at ease, trying to get down not just to the physical but even the psychosocial problems that could cause an impediment to the pregnancy that they have. All this can come only if adequate time and counseling is done for the patient, and it's not just giving injections or retrieving the oocytes. There are so many other things that contribute to, especially I think, a field like IVF, because it is truly a miracle for like giving birth. A new life is coming into being. So taking care of all aspects, physical, mental, emotional, psychosocial, each factor plays its role. And therefore, I would say a huge emphasis on counseling.
All right. So at your center, do you have a separate counselor, or is the main doctor only doing the counseling? What should be the expectations of patients?
I think definitely a separate counselor, but who is more trained in IVF related things, understanding what it is. Not just that, at our center, we have a nutritionist, an extremely, a very well trained nutritionist, especially for fertility factors. We have a yoga instructor. We are doing that on Zoom now. So, those people can come and join if that is required. We also try and do healing sessions for our patients, because I truly believe that these are important. Sometimes there is so much stress, and there are so many things which are actually unexplored for the woman. She is having a lot of fear sometimes, and a lot of anxiety. And if that is not addressed, then sometimes just giving the injections and making embryos and putting them inside does not help. So we have seen that when we have a combination of such healing practices, for example, we even have some Reiki sessions in our center, and we have meditation, guided meditations, we have yoga, we have breathing exercises, nutrition, and I think it plays a big role.
Really, do you think these things make a very big role? Because, we've had a previous fertility expert who came and said that when you're picking your fertility center or where you get your IVF done, look at the team. It's not just one doctor. It has to be, but his team was the technician, the embryologist, the lab, and everyone from the medical field. Now, why I'm asking this is because, increasingly over the years, we see more and more people are having a problem of fertility. Now, this could be because there are lifestyle issues, there are stress issues, and if you're eliminating them, does it really, statistically make a difference to success?
So that's a wonderful question, Alisha. One is, see, when we talk about IVF, it is teamwork, and IVF cannot happen without a team of doctors who are gynecologists, without a team of andrologists who look into the male factor infertility, without having a team of embryologists to take care of the lab, without having trained IVF nurses, without counselors. So, when we talk of an IVF center, it goes without saying that you have to have these people in place. Now, what can you offer beyond this is also the question. And if you ask me, statistically, frankly, I cannot cite definite studies where we have shown a significant increase in the IVF success rates, which are randomized. But you have definitely a lot of observational studies where they have seen that when the unabated stress and other things are taken care of, the IVF success rates can definitely increase. So the team has to comprise of the medical personnel. We cannot do IVF without that. But having these additions to your team is going to go a long way. That's definitely my take on it.
All right. Dr. Mamta, we started getting a few questions from the audience. We have a Facebook user who's asking, in IVF process, what is the chance of an ectopic pregnancy? And if it does occur, is this the error of the doctor or is it something that happens naturally by nature?
Okay. So even if you do an IVF, and in IVF, we place the embryos inside the cavity of the uterus, there can still be about a 3 to 4% chance of an ectopic pregnancy. This is because despite putting embryos inside the uterus, there are micro contractions in the muscles of the uterus, due to which the embryos can get pushed into different zones of the uterus and sometimes even inside the tubes. An ectopic pregnancy in IVF is especially likely to occur if there is a tubal pathology. That means if the woman is suffering from tubal infertility, where the tubes are affected, there are hydrosalpinges, the tubes are narrow or diseased, then the chances of ectopic pregnancy can increase in such women. But yes, there is still about a 4% chance, even in IVF pregnancies, that an ectopic can happen.
Right. Another question is, how much role does mental mindset of the patient play in the success of IVF?
I would say a huge role. Because ultimately, I do truly believe that beliefs make our biology. They do. There is now a part of medicine which is called as epigenetics. Now, what has always been taught to us that we are by default our genes. Whatever is given to us, we are going to manifest that. Now, epigenetics is a part which tells us it is not always like that. Your nutrition, your thoughts, your environment can play an influence on your genes and the wrong and manage or health for you. So in that way, your mental mindset, your energies, your trust, your faith, and how you kind of conduct and plan the whole process would make a difference to the outcome.
Definitely. If I feel that, patients focus on what happens once they have the baby in their arms, different happy feelings. And actually, the happy feelings come from hormones. It's all related in our body. So instead of what happens if my IVF doesn't work, if people focus on what I will do when my baby's in my hands, how will I change the diaper, how will I calm the baby, So those things perhaps may, actually prepare you for the life beyond IVF. The one thing that people are waiting for, they think, oh, success is big, but then, nothing prepares them for the success when it's in their hands. Once you start imagining that, perhaps it becomes better. So another user is asking, what the ways of healing for success in health and IVF? You spoke about Reiki, yoga. What else?
I think, healing is a very long topic. And personally, I think healing is a very personal journey. So, healing is different from curing. And we have always, as medical personnel, concentrated on curing. So, what really is cure? Cure is when you get a positive outcome or relief from a disease and it gets cured. Whereas healing is not necessarily a physical curing of the disease, but it is a healing of your thoughts, of your mental makeup, of understanding where things come from, of feeling grateful, of, going ahead despite the difficulties in a very positive state of mind. And it's not easy and it's very different for each person. So I would say healing is a personal journey. It's not easy. It's not a quick fix. It's not like popping in a pill, right? So you have to, do your work in healing.
Yeah.
But
self-discovery and effort.
Yes, it does. But there are various techniques. Even for example, when we talk about energy medicine, yoga is a form of energy, around your body. Meditation is a form of that. Nutrition is a form of that. Reiki is a form of that. So there are many breathing exercises, guided meditations, All these are forms of, energy medicine that can help you heal from within.
All right, so we are getting more questions, and this is just a request to everybody watching. If you're typing in your questions, do give us adequate details so that the doctor can address your questions completely. Mention the name, mention the age of the patient. We will not be taking names, but you can mention the age of the patient. If any associated, other factors are there like PCOS or endometriosis, please do mention it. Like we have a question now from a user saying, I've had failed IUIs. Please suggest, should I go for an IVF or should I wait for one more cycle of IUI? Now, we don't know why these cycles have not worked. What is the age? What was the sperm quality? But what would you advise, Dr. Mamta?
Yeah. So very important to understand the reason behind the failures, which we're not going to get unless we go into the details of the case. But just as a broad perspective, please understand that the best success rates in IUI are in your first 3 well-done IUI cycles. So, and generally after the first 3 failed attempts, the chance of IUI success is not very high. So it would be prudent to say that it wouldn't be wrong to embark on an IVF cycle, but again, it's individual. Looking at how these cycles were done, what are the individual case factors, male and female, and then taking a decision would be ideal.
Right. Another question is, my wife has low AMH level. Can she conceive naturally? Again, we don't know the age, but what would you say?
Is it low or
low AMH?
Okay. Now, again, low AMH is a very vague term. The value of AMH matters. So we have to know what it is. Do you mean 1.5, 1.2, 0.8, 0.2? So each value is going to change the chances of success. Having said that, depending on the age of the woman, we don't really say that any value of AMH would mean that this woman cannot conceive naturally at all. However, if the age is high and if her FSH levels are also very high, along with low AMH levels, then the chance of natural conception would be low. But in a young woman with a normal FSH and a moderately low AMH, there is still a possibility of natural conception.
All right. So now we have another question. I am 33. I have PCOD. I have failed 2 IUIs. What are my chances of conceiving with IVF? How can I improve egg quality in PCOS condition?
Okay. So I would say PCOS has a good chance of conception with IVF, even through IUI for that matter. But if IUI has not worked, then definitely IVF can be an option. In terms of improving egg quality for in PCO patients, one is nutrition, very important. Weight loss, if there is some amount of obesity, even about 10% of weight reduction and decrease in your weight will improve your oocyte quality and your response to medication. Then taking drugs such as we use certain drugs such as glycomet or myoinositol. So these are drugs which act on the metabolic aspects of polycystic ovaries and are known to help women who have PCOS. Also, we sometimes use medications which have coenzyme Q in women who have polycystic ovaries because it tends to enhance the cytoplasm and the egg quality. So looking into individual factors and using all these methodologies and the right and the correct stimulation protocol and the correct drug, all of these will help in giving better oocyte qualities.
All right. One user is asking, I did a laparoscopy last year. Still, I have scanty periods. What can I do for that?
Actually, the question is why, what was the indication for the laparoscopy? That is important. We do laparoscopy for so many indications. So, was it done for scanty menses? What was the reason for doing it? Because we don't really do laparoscopy to cure scanty menses. So what is the reason of the scanty menses? Is it some hormonal imbalance? Is it because the lining of the uterus is not coming up very well? So the base factor needs to be addressed. And just by doing a laparoscopy, the scanty menses are not going to get corrected.
All right. Now, one user is asking, is IVF safe during a pandemic?
I think right at the moment, there is nothing that is going to hamper your success of IVF even during a pandemic. The question really is, what is going to happen? Are you really going to be able to go, move in and out? What if you suddenly get infected in the middle of a treatment cycle? All these are the questions to be addressed, because now all the organizations which deal with IVF, national as well as international, have given very clear guidelines that IVF centers have to follow in order to make sure that the gametes are well taken care of and there is no passage or contamination of the virus. So if we follow all these things, there shouldn't be any need to worry. But yes, there are many other things and other factors that can come into play, not just doing the IVF, because we've had patients who were in the middle of their treatment cycles, and a couple of them, one of the partners got infected, with COVID, and then it becomes difficult. But now with the vaccines in place and, a lot of care being taken, I do not think that it should pose a problem.
All right. Dr. Mamta, another question has come in. I'm a 38-year-old woman. I had 3 miscarriages in the last 4 years. Each time I had conceived naturally. Do I need to opt for IUI or IVF? Now, this user's age is really not on her side. She's had natural miscarriages. Do you think you should investigate why this is happening before deciding what is the next course?
Absolutely, Anisha. You hit the nail on its head. I think it's important to first address the reason of the recurrent miscarriage, because conception is not really a problem here. So helping her conceive through IUI or IVF without addressing the reasons why the pregnancy is failing after conception happens will not really help the couple. So unless you first go down to the basics, try to find out what is the reason behind the abortions, just embarking on a treatment of IUI or IVF would not be ideal.
So how can that be done, Dr. Mamta? Very quickly, we're running out of time, but because, usually when investigations like testing the genes or the uterus lining is done is after a couple of cycles have happened and they have not worked. So what would you advise this user?
See, she is a case, we would call this a recurrent miscarriage. And there are certain investigations that are mandatory if a woman has a recurrent miscarriage. So it is basically, if we just try to think logically, what could be the reasons? There could be a problem in the embryo. Is there a problem in the uterus? Is there something in the body that is not helping this pregnancy go ahead? I mean, there are multiple factors and each has its ramifications. So trying to address all those investigations, like, testing the genetic factor of both the partners, looking into the uterine factor, looking into the quality of the eggs and the sperms, and looking at certain things in the body, like which sometimes prevent these pregnancies from going ahead, which could be autoimmune factors, hormonal disturbances. All these have to be checked before starting treatment or even trying to conceive naturally again.
All right, Dr. Mamta, thank you so much for joining us today and taking us through the tips to ensure success or to increase the success in IVF cycles. And thank you so much for answering so many questions. I'm sure the audience has learned a lot because the answers are simple and easy to understand. Thank you so much for joining us.
Thank you, Anisha.
So that was Dr. Mamta answering all your questions on fertility and IVF treatment during COVID-19. Now, if you have more questions and you can send them to us, you can just press on the WhatsApp button on the Facebook page and you can just type in your questions. We will try to take up your questions in the subsequent shows that we do in our series Project Start. Don't forget to follow us and stay updated on all that concerns your health and well-being. Once you follow us, you will get notifications on all the shows that we do and all the issues that we talk about. This program was supported by Bharat Serums and Vaccines under its public awareness initiative. We'll be back with our special show again. So stay tuned. Do follow us on Facebook for the notifications. Keep sending us your questions and we'll include them in our next show. Till then, stay at home and take care. Goodbye and see you soon.